Okay. All right, guys, welcome. We're going to get started here. Welcome to the Foods for Thought Brain Workshop. I'm Dr. Axtell, in case we've never met. Welcome. And food is your most powerful tool to resist age-related cognitive decline. The food you choose to eat can either protect you against the neuroinflammation associated with cognitive decline, dementia, Alzheimer's, depression, anxiety, brain fog, or it can promote that neuroinflammation, that brain on fire that Dr. Prentice is going to talk about today. So today we are going to start with the lecture and then we'll get into the food demos. We'll taste some healthy foods, and really our goal is to hopefully inspire you that neuroprotective foods can be not only practical but delicious too. So it is my pleasure to introduce Dr. Mackenzie Prentice. Dr. Prentice is our functional medicine nurse practitioner here at Lakeside. She has been providing integrative medicine consultations and primary care for adults here at Lakeside for over a year now. Dr. Prentice graduated from the University of Wisconsin-Milwaukee with a Bachelor's of Science in Nursing. After working as a registered nurse in a mainstream hospital medical clinic, she was inspired by her own healing journey to change course toward the functional medicine path. Integrative medicine and natural wellness quickly became her passion. She completed training as a functional medicine provider through the Institute of Functional Medicine, or IFM. She then went on to earn her doctorate in nursing practice from Marquette, where she focused on integrative medicine specialties. Her experience in the conventional world has given her a unique skill set to use an all-inclusive approach to identifying the root cause of chronic conditions. So Dr. Prentice, welcome.
Thank you. Hi everyone, I'm Dr. Prentice. I'm honored to stand alongside Dr. Axtell today to talk to you all about brain health. So let's dive right in. So my goal today is to empower you all to
prevent future diagnosis of Alzheimer's and dementia, while also today improving your cognition, focus, and mood. So briefly, just kind of a quick overview of some terms. So cognitive decline. When we talk about cognitive decline, we mean brain decline, brain function decline, right? So a lot of people think memory loss. Dementia is the term or diagnosis we give for people who have memory loss. Alzheimer's is one form of dementia. And I don't want you to memorize this, but
we'll talk about the hallmark signs of Alzheimer's throughout this presentation, so I just want to touch on it. When we look at brain scans of Alzheimer's patients, we see two things. We see amyloid plaques and tau tangles. So plaques and tangles. We don't know a ton about these. New research keeps coming out about them, but we know that differentiates Alzheimer's from other dementia diagnoses. Of the current living Americans, 45 million will develop Alzheimer's disease in their lifetime, which is pretty astounding. We previously thought that Alzheimer's has no cure, and I'm happy to report that there have been actually documented cases recently of reversals of Alzheimer's and dementia, which is pretty cool. We're still kind of in the newer phases of this, but that gives us good hope, right? And then this is just a really great slide to emphasize how important prevention is. Like I mentioned, there is some reports of reversal, but still we're in the early phases, and prevention is the best cure. So of brain images, they see that as young as 20 years old, there can be changes. And when I say changes, usually it means that the brain is shrinking. And then another alarming stat is 49 is the average age of somebody living with
dementia today. So kind of a scary stat, but again, today we want to empower you to take control of that, because there are ways to prevent that and reverse it. So if you think of somebody diagnosed with pneumonia, for example, everybody diagnosed with pneumonia has the same cause, right? They all have a bacterial infection. If you have a bacterial pneumonia infection, we treat everyone with an antibiotic, right? That is how we have kind of historically treated cognitive conditions, right? Anxiety and depression, we don't really know the cause, but we treat them with antidepressants, anti-anxiety medication, right? Same with dementia. Not really sure the cause, but we try to treat it the same way, unsuccessfully. Now, with new research coming out, we can identify the six main contributors of dementia, but this can go across the board even with depression, anxiety, brain fog, things like that. Which is great, right? Because now we have a way to individualize our approach, right? Two people with dementia could have very different reasons that they have dementia. Or two people with depression could have two very different reasons for depression. So once we know the contributors, right, we can then treat. So the first step is testing. Now this is not a comprehensive list, but these are some of the more comprehensive labs that a lot of them we do here at Lakeside and can be very helpful. I will say even, especially like females postmenopausal, hormones can play a huge role. That could be the primary reason somebody has memory loss, is low progesterone, low estrogen, things like that. We see nutrients, we'll talk about inflammatory markers, and then genetics are kind of a big kind of thing that we talk about nowadays associated with Alzheimer's. So I just want to touch on that specifically. So the Alzheimer's gene, maybe you've heard of the ApoE4 gene. Now, of anybody over the age of 65, this is one of the highest risk factors if you have this gene. Historically, this was actually a really good thing if you had this gene. With our ancestors being exposed to all of these different infections when they're eating out in nature and walking around barefoot, they needed that inflammation to kind of help them survive. Now, we don't want as much inflammation, right? So it is more harmful to us. So this is a marker that we can test for, and it can help guide treatment. So think of genes, though, as a light switch. So it's not inevitable. Just because you have this gene or don't have this gene doesn't mean you will or won't get dementia, Alzheimer's. We can turn that light switch on or off, right? In this case, we want to turn that light switch off. So we'll talk about a lot of foods that can help flip that switch off, coconut oil being one of them. We can test for it, right? And there's some other things we can do also to kind of help reduce your risk if you do have this gene.
What's MCT oil?
MCT oil it's part of coconut oil, but they've extracted it from the coconut oil, and you can get it at any grocery store. So, yeah, really good for the brain. And now maybe you've heard Alzheimer's has coined the new type 3 diabetes. Insulin resistance, or if we have too much, so glucose, right? When we take in carbohydrates and sugars, so think simple carbohydrates, breads, cookies, donuts, bagels, any of that increases our risk not only for type 2 diabetes, but also Alzheimer's. Research shows that it shrinks our hippocampus, that's part of our brain, the memory center of our brain. So again, food is so extremely important in not only preventing, but also kind of reversing. And this is true too, again, with these simple carbohydrates and glucose as fuel. It's really important too in the setting of depression or anxiety. All right, and then Dr. Axtell mentioned neuroinflammation or brain on fire. So inflammation plays a huge role in Alzheimer's, depression, it's very well established that neuroinflammation or inflammation in the brain is highly correlated to people with depression. The great news is we can test. There's inflammatory markers out there that can test to see if you may experience more inflammation in the brain. CRP is one of those levels. And then we can prevent, right? So avoiding some of the top inflammatory foods, which we'll talk more about later on. And then also treating the inflammation. So turmeric, maybe you've heard of that, especially if you've been here at Lakeside. It's a great anti-inflammatory herb that can cross the blood-brain barrier, meaning it can really get into the brain and reduce inflammation. So we'll talk more about that too, but that's a really great thing to add to lots of foods. And we'll trial that later in one of the recipes. Okay, BDNF. I just want to touch upon this because we will talk about it too as I go on. Brain-derived neurotropic factor. Think of this as miracle grow for the brain. It can create new neurons in the memory center of the brain. We want higher levels of this, and so there are a lot of practices that we'll talk about that can increase these levels. So BDNF, miracle grow for the brain. All right, so let's get to some tangible things that we can do to, again, prevent Alzheimer's and dementia, but also, again, improve your focus today, improve your mood today. So exercise. I will say the more and more I read about brain health, this is hands down, this and nutrition is huge for our brain health. There is not a single FDA-approved medication out there when it comes to treating depression and anxiety and also dementia and Alzheimer's. That even comes close to being as effective as exercise. Because one of the main things for any kind of neuro condition is we get reduced blood flow to the brain. And so exercise can help us, right, get that blood flow to the brain. We need that blood to make our brain work, right? So, you know, exercise has all of those good benefits that we know of, right? Healthy weight, improving muscle, bone growth, things like that. That's really great too. But then again, the blood flow to the brain is huge. It can improve endorphins, right? Those are really good for mood and improved focus with that blood flow. So the research shows that a combination of different exercises is great. So cardio is important, especially more endurance. So high intensity or sprinting can be important for certain things. But if we can do walks, we can do biking, you know, slower runs, endurance is really going to be helpful for long-term longevity of our brain. And then strength training is really great. And for Alzheimer's and dementia, the research, I'm not really sure the kind of mechanism behind it, but strengthening your legs specifically. And then also gentle forms of exercise like yoga and walking, right? That can also reduce our stress levels, which is important for our brain. Okay, and sleep. So we've probably all heard that sleep is really important as well. Remember when I talked about the Alzheimer's hallmarks, the plaques and the tangles? So old thought, once we have those, we can't do anything about them, right? It just is what it is. You've got Alzheimer's, you've got these things in your brain. But new research is showing that we can actually clear some of those plaques and tangles, which is really cool. And the system that clears these from the brain, in addition to clearing toxins, so think toxins, inflammation, is increased by 20-fold when we're sleeping. And it's not only important to get, 7 hours of sleep, it's really important to make sure you're getting that good, deep, restorative sleep. So that means, having good sleep hygiene, right? Good sleep practices. And then you can use some safe sleep aids to help. Now, some can be harmful, and we'll talk about those later. But if you use something like magnesium, melatonin, things like that, those can be very supportive. Melatonin is extremely important too for our circadian rhythm and restful sleep, right? So one simple thing you can do is even just get morning sunlight, right? Immediately when you wake up, even 5 minutes, and then sunlight when you before you go to bed or when the sun is setting. That can help promote melatonin, which again is helpful for maintaining that blood-brain barrier integrity, meaning keeping those toxins out. So extremely important. Okay, and then stress management. So stress gets a really bad rap, and for probably good reason nowadays, right? We're under a lot of stress. We're exposed to chronic stress, severe stress, and it's really challenging to kind of overcome that in certain situations. The stress is not necessarily what's a problem, it's how we react to it or how much we're exposed to it. So prolonged periods of stress can increase our cortisol, our fight or flight stress hormone you've probably heard of. We want that to rise in stressful situations, but we also want that to drop afterwards, right? So chronic stress has been shown to shrink the brain. But if we can teach our brain to become resilient and overcome this stress, this is really great. So even putting yourself in tiny stressful situations, like, think about in middle school solving a math problem, right? That's a little bit of a stressful situation, but you solve it and you overcome it. Cold therapy or cold showers are a big thing nowadays too. That just helps your body build resilience and overcome stress, so that in those periods of more severe stress, your body knows what to do. So it's really important to get these stress reduction techniques into your daily life, even when you're feeling good, even when you don't have any stress, because then your body knows what to do in those stressful situations. I really love grounding or forest bathing or just going out in nature because you can immediately feel a benefit, right? With your mood, take your shoes, take your socks off, walk in the grass. It really can make a huge difference pretty immediately. And yeah.
What is forest bathing?
Forest bathing, essentially getting out in nature, walking through the forest. So any type of nature, hiking or getting out on the water. Yeah. Good question. Okay. And then neuroplasticity. So another old thought was once we lost brain function, it was irreversible. But research shows that no, our brains can continue to grow new neurons, even as we age. Even if you have gone through a traumatic brain injury, for example, concussion, right? I would say if you have had a history of concussion or other brain injury, it is really important to kind of treat that, right? Because we're getting inflammation with those injuries and reduced blood flow. So you already have an increased risk, but we can do some things to kind of improve that blood flow. I read somewhere that out of all of our organs in our body, the brain has the most potential to strengthen and grow new things, right? So we can change our brain. We can grow new neurons, and that can change our life, right? The brain is really important for so many things. And so different ways to create neuroplasticity, learning a new thing. So don't stop learning, after school, after college, after high school. Keep learning, playing a new sport. Pickleball is a really big thing nowadays. If you haven't tried it, it actually, again, the research shows that actually pickleball, out of all the kind of sports out there, is a really great brain game because you're not only moving around, but it takes kind of that challenge. So building new neurons.
And I think the social aspect.
And the social aspect,
right,
yes.
is so important.
Yes.
For our brains.
Yep. And that's important for stress management too. Those social interactions play a huge role in our mood, right? All right, and then kind of for the big, this is why we're all here, right? The nutrition. So nutrition is so important not only for prevention of the dementia, but also improving our mood right now, immediately. The food that we eat can have a direct impact on our focus and mood today as well. So there are a lot of diets out there, right? And people have differing opinions on what is the best diet. Overall, for brain health, I say plant-based here, but when I say plant-based, I mean plant-rich. So not necessarily avoiding meat, but plant-rich, nutrient-dense whole foods. So we want good diversity of vegetables and fruits with an emphasis then on good healthy fats with some good protein as well, and bonus points if you can get local, in-season, organic foods. So metabolic flexibility is key for brain health, and so we'll go into that. Okay, so we talked about Alzheimer's being the new type 3 diabetes, right? And that is because glucose acts as essentially dirty fuel for our brain. So it does fuel us, but actually over time, our bodies cannot use glucose very well to fuel itself. Glucose can also create free radicals, which are things that can rapidly age us. So once we are no longer effectively able to use glucose, if we don't give it anything else, that's a bad combination. The good news is we have a better fuel. Ketones, if you haven't ever heard of ketones, are essentially our body fat or fat, good healthy fats that we eat. It's those fats broken down. This is really great clean fuel for our brain. And there are several different ways that we can promote this. So fasting can be one. We'll talk about that a little bit. Reducing the carbohydrates that we're taking in, and then optimizing our fat and protein intake with those carbohydrates. And then again, exercise, right? That can increase those ketones in our body and our brain. And then for various reasons, we might add external ketones, so that MCT oil or coconut oil is helpful, but then those good healthy fats. Ketones can increase that BDNF, so again, think miracle grow for the brain, right? Can increase that. So improving both our mood and our memory. So how do we build a metabolically flexible body? So metabolically flexible means that we want our bodies to be able to switch between glucose for fuel and our fats for fuel. Fats tend to get a bad rap, especially in the kind of heart disease world, right? Cardiovascular world. And the reason is that we are adding these good healthy fats in without eliminating the inflammatory foods. So if we add in the good healthy fats with, if you're already eating, bagels and cookies and donuts, that's a bad combination. So the first step in building a metabolically flexible body is you've got to pull out the inflammatory foods. So sugar, simple carbohydrates, dairy can be inflammatory, and then gluten as well can be pretty inflammatory for not only our gut and also our brains. So step one is try to eliminate those, and that's why it's really great here at Lakeside. We do a lot of this, right? Working one-on-one, we can help kind of individualize the metabolically flexible body. So pull out those inflammatory foods, and then we want to increase those good healthy fats, because again, they can increase that miracle grow, that BDNF. Salmon, we'll try a salmon bowl later on, so that'll be really great. And then olive oil, you do have, I think in your packets, a handout on how to choose a good olive oil, because unfortunately we do have to be kind of choosy with our olive oils. So use that as a guide, take it to the grocery store to help you pick your olive oils, because quality does matter with this stuff. Some more good healthy fats, avocados. Avocado oil is a really great oil to cook with because it's got a higher smoke point, basically meaning it keeps its form at higher temperatures, which is a good thing. And then nuts, like walnuts. Walnuts are shaped like a brain, right? So nature is pretty wise. That's not on accident. So eat walnuts.
Any other nuts?
Yeah, pecans, almonds, macadamia nuts, Brazil nuts. Those are good ones. So we've got the good healthy fats, but there are some fats that we want to kind of avoid or limit as much as possible. I'd say with most foods, quality is going to be optimal. If you can get good quality, so for meat, for example, grass-fed is important, pasture-raised, organic, and then limiting red meat to once a week is most beneficial because they've got really great ingredients in there, but it can be slightly inflammatory in certain cases. And then pulling out, if you can do, I'll probably say this multiple times, but if you can do one thing in your diet, pulling out the inflammatory oils is huge. So even in processed crackers and cookies, things like that, you want to pull out the inflammatory oils, which are listed here. Okay, dairy. So overall, dairy can be, this conventional dairy that we eat, it can be inflammatory. So it's best to avoid, and again too, it's in certain scenarios, you may want to avoid different forms of dairy. So that's why it's best to work with your provider here at Lakeside. But if you are going to eat dairy or you do tolerate dairy, organic is optimal. Yogurt and kefir they're good for the gut, fermented. And then there is a protein called casein in milk, and there are two different forms. There's A1 and A2. A2 is more well tolerated amongst people than A1. So if you're lactose intolerant, though, you would have to avoid this as well. And then goat and sheep cheese, they are lower in that casein as well. So if you're going to eat dairy, choose wisely, right? Get good quality. And then eggs. So I would toss out any knowledge from the 1990s that we learned about eggs. Eggs are really good, high quality foods, including the yolk. So really great and good healthy fats, good minerals and vitamins, and then it's rich in choline. Choline is important for production of acetylcholine, which is a neurotransmitter responsible for learning and memory. In pregnant women, we want to optimize their choline intake for the fetus and the brain development. So this is one of those nutrients that we optimize. So, but it's great for everyone. Hard-boiled eggs are great to have on hand, right? Quick protein snack, high in protein as well, to just grab and walk out the door with. And then dark chocolate. So I think this is probably one we can all get behind, right? Get excited about. Chocolate is good, but you do want to be choosy again, right? With the quality. You want low sugar and 80% or higher of the cacao content. Hugh Kitchen is a brand. If you guys haven't heard of that or seen that, I think you can get it at most grocery stores now. That chocolate is a really good quality, organic, low sugar option. And then cacao nibs is another good option. All right, and then vegetables. So non-starchy vegetables, think broccoli, cucumbers, cabbage. These are really great not only for our gut with the good fiber. Yeah, so the goal is 6 to 9 cups a day, which seems very hefty, but very doable. You start with 1 or 2. You want to go slowly with this if you're not eating that much already. Think about it. It's 2 cups with each meal, right? So when you break it down, it can be more manageable. You want to aim again for good quality. You can spice it up. If you add good healthy fats to your vegetables, again, that can help fuel your brain with those ketones and help heal that insulin resistance. And insulin resistance, we mean kind of prediabetes, diabetes, our body's ability to use glucose. And I challenge you to go to the grocery store today and pick up a vegetable that you've never heard of or never seen before, and Google how to make it and try it. That's a good way to just start kind of experimenting or getting comfortable with new vegetables. And then I want to highlight one specific non-starchy vegetable, the leafy greens. So research shows that I think there was a study done with adults 70 and older that if they had at least 1 cup a day, they showed a slower rate of cognitive decline over time. So I encourage you to up that, though, to 2 cups. Greens are rich in something called folate. It's a B vitamin, and that helps reduce an inflammatory marker in our body called homocysteine. Homocysteine, when you have this in higher levels in the body, puts you at higher risk for not only Alzheimer's and dementia, but also cardiovascular disease. There's also research showing that it can impact diagnosis of depression and anxiety too. And we'll try a smoothie later that has some spinach in there. That's a really good way to hide those leafy green vegetables, right? Put it in a smoothie. All right, fruit. So fruit is another great source of fiber. If you're choosing fruit, be choosy with lower sugar fruits, so berries are best. And out of all the fruits and vegetables, blueberries are the highest in antioxidants, specifically something called anthocyanin. Anthocyanins are, if you think of any food that has this purple or blue color to it, so purple sweet potatoes, blueberries, forbidden rice, things like that, that has those anthocyanins, which can accumulate in our hippocampus, so in our brain, our memory center of the brain, and improve our memory. All right, and then back to that turmeric. So turmeric is that anti-inflammatory herb that can cross that blood-brain barrier. So we use it to help with brain inflammation. We use it for depression as well. This is nearly tasteless. You can buy it as a spice. You can get it as a supplement. Sprinkle it on anything. Sprinkle it on your vegetables, your proteins. Again, doesn't really taste like anything. It can stain things yellow, so just be careful with that. But easy way to just get some added benefit of an anti-inflammatory herb. And we'll have that on one of our recipes later on today as well. All right, and then green tea. So green tea is a really great alternative to at least one of your cups of coffee in the morning. It's high in anti-aging oxidants, and a really great source of something called L-theanine. So I use L-theanine a lot in my practice with patients with anxiety as a pill. You can get it in higher amounts, but L-theanine is really helpful for supporting mood and also focus and memory. I explain it as like a calming focus that you get, and you can get that with the green tea. We'll trial some matcha. That's a good source of the L-theanine and EGCG in our smoothie later on today. Okay, then other beverages. So human brain is 80% water. So that says in itself that water is extremely important, right, for our brain health. Research and studies show that there is shrinking of the brain when we are dehydrated. So think brain fog, fatigue, mood changes with dehydration. It makes sense. So goal is half your body weight in ounces daily. And then alcohol, across the board, alcohol really is a neurotoxin to our brain. So if you can avoid it altogether, that's optimal. Or at least avoid more than 4 drinks a week. And then again, be choosy with what you're drinking. Get really good quality, organic. Red wine is a good one. Low sugar. Okay, so it's not only what we eat, but also when we eat that can impact our brain. So fasting. There are different ways to fast. We can fast for several days. We can intermittent fast or time-restricted eating, where we kind of condense our eating time throughout the day. Fasting can be really beneficial because it promotes something called autophagy. So think of autophagy like little garbage trucks going around and picking up all the toxins in the body and eliminating them from the body. So really great. I will say with fasting, it would be probably best to work with a provider because fasting can also be stressful on the body depending on your presentation. Going back to that gene, that ApoE4 gene as well, different times of fasting, they may benefit from longer fasts throughout the day. I will say that across the board, most people could benefit with fasting for about 12 hours overnight. So between dinner and then breakfast the next day, having 12 hours can promote some autophagy and can be very safe and effective for most people. And then too, if you can get 2 to 3 hours in between dinner and sleep, that promotes better deep sleep, and again, good for the brain. Okay, and then the gut. So think healthy gut, healthy brain. 90% of our serotonin levels, so serotonin, think happy, that this is the neurotransmitter that is linked to happiness. So we want a good, healthy gut, right? If you do have any GI symptoms, so even if you're not having regular daily bowel movements, it is really important to work with a provider to get that under control. And then some of these foods that we'll talk about now can be very supportive of the gut and the brain, but you just want to be careful because if you do have any gut issues, they could be problematic in the beginning. So
do you mind repeating what you said about serotonin?
Yeah.
I didn't quite catch the connection.
Oh, yes. So serotonin. Serotonin is a neurotransmitter, and 90% of it is in the gut. So think serotonin equals happiness. And so if we think about our mood, right, if our gut is off, decreases our serotonin, right? Good question. All right, so fiber. We've got vegetables and fruits, really great sources of fiber. Again, you want to slowly increase your fiber intake to prevent any gut symptoms. Fiber can be good sources of prebiotics, and so I have a list of prebiotic fibers over on the side there. Prebiotics can feed our gut microbiome, the good bacteria. And when we feed the bacteria, they can create something called butyrate. Butyrate increases that miracle grow, BDNF. Butyrate also reduces inflammation, and butyrate is also linked to good healthy weights in people too. Resistant starches. So resistant starches, there's a list of a bunch on the side, are starches that take longer to absorb, which means they make it all the way down into our large intestine, so way at the bottom of our intestinal tract. And then they're fermented, so our bugs can, our microbiome can really benefit from this, right? A tip, if you're eating white potatoes, if you can cook the potatoes, let them cool, put them in the fridge, maybe the night before you eat them, next day heat them back up, you're further increasing the resistant starch in there. And then probiotics. So there are lots of good probiotic foods out there. You want to experiment slowly with these because they can, if you have GI symptoms, again, it can kind of worsen things. And then we've got a great variety of probiotics in pill form as well, depending on kind of what we're treating. Okay, now we'll just touch on a couple things to avoid for brain health.
Quick question.
Yeah.
When you talk about pre-cooking the white potato and then refrigerating it and heating it up, what's your take on microwaves and heating up food that way?
Yeah, I would say that optimally, microwaves aren't the best way to heat things up. So use the oven or put them on the stovetop. Most people have microwaves nowadays. So, but I would say if you can limit the amount of time you're using the microwave, that's a great question. So heating them up on the stovetop or back in the oven would be optimal. So aluminum. Aluminum, actually, a lot of it is stored in our brain and can be associated with many different brain conditions. So think about, throw out your foil, get parchment paper to cook your food with. Deodorants, you want to watch out for that, aluminum's in deodorants. So Native is a good brand. I think Primally Pure is another good brand. Look for aluminum free. A lot of them will state that right on the packaging. And then baking soda, you also want to look for aluminum free baking soda. Crazy, right? We didn't know we had to look for aluminum free baking soda. And then there's a list of some other things too. Filtered water is really beneficial for just overall health. And then this isn't a comprehensive list of medications that can impact the brain, but these two are highly correlated to Alzheimer's, dementia, and even depression, anxiety. So statin medication. Statins are used to lower our cholesterol levels, but cholesterol is extremely important for our brain health. A lot of our brain needs that fat, right, for fuel. There is research showing that lower cholesterol levels are also linked to depression diagnoses. So you want to be careful with the statin medication. And then there's a lot of research out there too that this can directly impact your risk of Alzheimer's and dementia. So if you are on a statin, there's ways to work to get you off of it. And we can do that in a safe way. And then sleep aids. So I mentioned sleep is extremely important, and there are some safe sleep aids out there, but there are a lot of sleep aids too that can be harmful. So benzodiazepines, if you've heard of those before, and there's a list at the bottom there. This prevents our brain while we're sleeping from transferring information from our short-term memory to our long-term memory. So then thus impacting our risk for dementia down the road. So again, if you have any issues with getting that deep sleep, aim for the magnesium, the melatonin, work with a provider to help you get that good deep sleep. Okay, and we'll touch briefly on a few good supplements for the brain. You do in your packet have a list, and it goes into more detail about all of these and dosing information. We'll touch upon lion's mane in a moment. L-theanine, we talked about that being in green tea, giving you that calming focus. Have that as a supplement. Cerifos is another great one for sleep that we use all the time here at Lakeside. Can help lower cortisol levels. Fish oil, anti-inflammatory and feel for the brain. B-complex, so those B vitamins found in leafy green vegetables, right? You can get that as a supplement that can lower homocysteine, that inflammatory marker in the brain. And then curcumin or turmeric, that spice that you're going to add to everything. You can also get that in higher doses in supplement form. And then lion's mane, I think we had that somewhere here, but oh yeah, perfect. So this is one of my favorite supplements for the brain. So this increases levels of nerve growth factor, which essentially promotes new brain cells. It can reduce inflammation. This is a mushroom. You can drink it as a tea or you can get it as a supplement. There's the dosing there for you. We have all of these supplements here if you do want to ask any more questions about them or purchase them today. These are all really safe, effective supplements for the brain. Okay, and in summary, so cognitive decline can begin as early as in our 20s. So we see brain changes on imaging really young. Prevention is the best cure. And the good news is we now know contributors, we have testing, we have ways to prevent and treat, which is great. And then we also know it's a very individualized kind of approach, right? If you do have depression or anxiety, your treatment may look very different from somebody else with the same diagnosis. Again, genetics are not the end-all be-all. It's good information to know, and then we can guide your treatment. And then that foundational support is key, specifically exercise and then nutrition. So again, what we do now can set the stage and kind of set us up for success today and down the road for prevention. Okay.
Thank you.
I'm done, yeah.
Good job.
Maybe bubble up. Maybe it's another B vitamin. Yeah. Yeah.